Day. We are so excited to have you guys all join online from all over Australia. Before I start, I'd like to acknowledge the traditional owners of the land on which we are meeting on today. For us, that is the Bunurong people of the Kulin Nation. Polo is at my house right now. And also extend the respect to the traditional owners on the land on which you are all joining, like I said, from around Australia, and acknowledge any First Nations people who are joining us today. So obviously we're here for World Vitiligo Day, and for anyone who doesn't know what that is, it is a day for us to celebrate the lives and the strength of the community of vitiligo. It was first established in 2011 and has grown globally to be an annual campaign dedicated to raising awareness for vitiligo and supporting those affected by the condition, and as well as gain awareness and interest about vitiligo to the big pharma brands, so that more companies can invest time and research into both research about vitiligo and also treatment options, whatever they may be. A little fun fact, if you didn't know, that World Vitiligo Day actually originated before 2011. It actually was unofficially around in India in 2009. So they were the first to, get on board. But it was actually celebrated on the 19th of May. And has now, since 2011, has been moved to the 25th of June to commemorate Michael Jackson, who was one of the most famous celebrities in the world who also had vitiligo. He actually died on the 25th of June, which is why World Vitiligo Day is now today. And if you've seen the Michael Jackson movie, there is a mention of vitiligo in there, and I'm hoping that in the second one there is more about it. But yeah, every year there's a new theme. This year's theme is from Stigma to Strength, which we are celebrating today, and we'll also be debunking some myths like Paulo mentioned, and really kind of coming together to be a strong unit together. So throwing it back to you.
Yeah. So thank you so much for joining us. I'm just going to briefly introduce to everyone who has joined us so far. I'm one of the committee members. We have Onela as well from the Vitiligo Association of Australia. We have Nada online. She's been with VA for many, many years, and she's been a backbone since. And we also have Mohan, who is our tech-savvy person online. So I'm so grateful to see all of you. We also have, I can see I'm not sure, I might be wrong, Dr. Monisha Gupta is also online. Might be, I'm not sure, yeah. So I just wanted to say thank you so much, and we will start with our first session of the day. So back to you.
So I feel like we're doing a newsreel. So our first speaker is Dr. Kanika Sahni. She is a Distinguished Fellow of the Australasian College of Dermatologists and a former professor of the All India Institute of Medical Science in New Delhi. She is currently a specialist dermatologist at the Skin Hospital and Blacktown Dermatology, and she is a global leader in procedural dermatology. She specializes in advanced vitiligo surgeries, cellular grafting, and melanocyte stem cell research. With over 50 publications and extensive textbook contributions, she brings world-class expertise to our event today. So thank you so much for joining us, Dr. Sahni.
Thank you so much, Anela. It's my pleasure to be here on Vitiligo Day. This is my first time doing an event in Australia because I've only recently moved, but it's great to be part of this community.
Thank you. We appreciate your time, and yeah, go for it.
All right, so I'll just share my screen. All right, let me know if it's visible.
Yes, it's good. Thanks.
All right. So it's my pleasure to be here on World Vitiligo Day. And so this is where the World Vitiligo Day is being celebrated for the World Vitiligo Foundation. And that is in India, in Chandigarh at PGI. And that is where I actually trained in dermatology roughly 20 years ago. And This is where I was first introduced to vitiligo and, vitiligo surgeries, medical treatment, phototherapy, and I owe a lot to this institute. So today I'm going to discuss briefly about what vitiligo is, why it occurs, and some brief, new aspects in the treatment of the vitiligo. So we know that vitiligo is a disease that causes white spots in the skin, but not everybody can wear these white spots with confidence. And in fact, a large percentage of patients, particularly in countries like India or other parts of South Asia, are significantly affected by the stigma associated with the disease. So just to begin, we need to know what gives the skin its color. And it's this cell here, which is called the melanocyte. So if you look at the structure of the skin, one melanocyte is roughly connected to about 30 to 35 keratinocytes, which are the backbone of the epidermis in the skin. And it is these melanocytes that produce the pigment, which is then transferred onto the keratinocytes so that it gives the skin its color. But what happens in vitiligo is that there is influx of inflammatory cells into the skin, which you can see here. And these inflammatory cells enter into the epidermis and they attack the pigment cells there. And that leads to death of these melanocytes. And thus, certain areas of skin do not produce pigment and they turn into white areas or depigmented patches. So a common question that most patients want to know is that what causes vitiligo? And I would say that it's a big interplay of different factors that play a role in causing these white spots in the skin. There is a definite role of genetic predisposition, which is quite closely interrelated to the autoimmune aspect of the disease. And there's something in addition to these two aspects, which triggers off the onset of the disease only in certain individuals and not others. So if you look at the image on the left, as I said, it's a complex interplay of genetics, immune dysregulation, and the environment. And it's only when all three of them fall into place together is when a patient would manifest with vitiligo. And if we look at the genetic architecture of vitiligo, we know that, more than 50% of it would be contributed by common genetic variants, about one-fourth by rare genetic variants, and the remaining 20% of the contribution would be by environmental factors. So we all know that globally between 1% to 2% of the world's population is affected by vitiligo. And it's quite common. About 15 to 20% of patients will have at least one family member in first-degree relatives who is affected by the disease. It's a big concern, particularly in certain populations, that vitiligo is a genetic disorder, and so people sometimes don't want to marry into families that have vitiligo. But what I generally tell my patients is that having a family member with vitiligo doesn't necessarily mean that you will develop vitiligo, and in a similar way, not having a family member with the disease does not rule out the development of vitiligo in an individual. So a rough estimate of the increase in the risk if you have a family member affected by the condition is that it increases the risk of developing vitiligo by 5 times compared to the general population. So if the general population has a 1% incidence, the incidence would be 5 to 6% in a person with a first-degree family member. So this was an interesting study from Korea that found that even monozygotic twins, which means twins that are genetically identical, will show a 25 times higher risk of developing vitiligo compared to the general population. But not all monozygotic twin pairs will all have vitiligo together. And this just generally implies that there is a strong environmental component, which is important for the development or the precipitation of the condition, even though the genetic factors may be present. Not all the patients with similar genetics will also develop the disease. So At the moment, we understand that it is a polygenic inheritance, which means there are multiple different genes that are involved in the pathogenesis. We have been able to map the genome. There are genome-wide studies that are available, but we still cannot predict, with certainty as to which patients with the right genetic environment will develop vitiligo. And even if they do develop vitiligo, how rapidly or how slowly it will progress. At the moment, prenatal testing does exist, but only in some laboratories. And it's not reached that level of sophistication where we would be able to give the patient, exact estimates of the likelihood of developing vitiligo, even if the genetic testing shows a positive result. So, in the future, genetic counseling might help if, there's a strong family history of autoimmune disease in both parents, or strong family history of vitiligo in multiple members of the family. Now, coming to the autoimmune associations, we also know that having vitiligo predisposes the patients to developing a higher risk of developing other autoimmune conditions, including autoimmune thyroid disorders, alopecia areata, type 1 diabetes, and a whole gamut of autoimmune conditions. But we also know that segmental vitiligo, which is a distinct subtype of vitiligo, is much less commonly linked to the autoimmune conditions. So generally, it does make sense for patients with vitiligo to have a baseline evaluation to rule out any of these autoimmune conditions, and then to have follow-up evaluations once every 1 to 2 years, just to make sure that they haven't subsequently developed another autoimmune condition. And as I said, we know that there are definite environmental influences. Some of these are known and some of them are yet unknown. So we do know that, in some individuals, the use of hair dyes or other chemicals that are implicated in causing damage to the pigment cells, including hydroquinone or other pigment lightening agents, can precipitate or aggravate vitiligo if it exists. There's a definite role of trauma. So it's not uncommon for us to see patients with vitiligo around the waistband where, they wear tight clothing, or around straps, or, following some kinds of surgery or trauma or scars from prior trauma, developing white patches. There is a role of oxidative stress and, psychological stress, but that is, again, a very complex scenario. It's not simple enough for us to just prescribe antioxidants and treat vitiligo. So it does play a role, but it plays a partial role. Now, recently, with the evolution of immunotherapy for melanomas, we know that some of these agents can cause vitiligo, and the treatment in those cases will slightly differ. Now, there are some myths related to vitiligo, and a number of alternative medicine practitioners would recommend avoidance of certain diets or certain elements in the diet for patients with vitiligo. But at the moment, the scientific literature does not suggest that there is any significant role of specific dietary items, neither in the prevention nor in the treatment of this condition. There is a lot of information around the internet about the use of supplements like ginkgo, polypodium, or others, or antioxidants. But again, there are small studies that have shown some improvement with the use of these supplements, but these cannot be considered as standalone treatments for vitiligo, and instead, they could be used as supplements to standard treatments. So the level of evidence for these treatments is still quite low. Now, coming to antioxidant supplements, we know there's a definite role of reactive oxygen species and oxidative stress in the causation of vitiligo. And there is some role that has been found for vitamin C and other antioxidants in smaller studies. But as I said, we could consider them as adjuvants to treatment and not as sole treatments. And it's possible that, an overall healthier diet with like more whole antioxidant foods might play a better role rather than individual antioxidant supplements. Now, when we come to the vitiligo treatment, there are mainly 4 types of treatment that we might consider for patients with vitiligo. One of them is steroid or calcineurin inhibitor creams. And these work by suppressing the immune responses and initiating melanocyte proliferation. And that results in improved pigmentation. The next possible option is oral treatments. And we would use these treatments in case the disease is rapidly progressing. Traditionally, we used to use only steroids or other traditional immunosuppressants like methotrexate or azathioprine. But more recently, there has been a role of JAK inhibitors in the treatment. There's a definite role of phototherapy, which I will discuss briefly, and surgical treatments as well, which I will come to. So as I said, there's a whole gamut of treatments available for vitiligo, and it's up to a trained dermatologist to be able to suggest what might be the best treatment for an individual patient. And if we look at this vitiligo patient journey, we look at these patients who have white spots, and then, for a long time, they might toss and turn between Dr. Google, Dr. Foggy, some self-help, some healers and dietitians. And only after a certain delay would they actually end up reaching a dermatologist and getting appropriate treatment, which could be, in the form of medical or surgical treatments. And apart from that, there's the major role of psychotherapy or, the assessment of the impact that the vitiligo has on the quality of life, so that the patient can shift their focus from the white spot to considering themselves beautiful. It's really important that patients beware of false claims on the internet. So if you look at the picture on the right, it's not possible for vitiligo to repigment in a short period of 1 or 2 weeks, as shown in that picture. So it's important to understand that if there was a cure or a miraculous treatment for vitiligo, it would definitely not be a secret known to only those who stumble upon it on the internet. So it's important that, there's a whole lot of information on the internet, but, it is up to us to decide what is the right source of information. And in fact, more recently, the Australian Medical Association has actually approached the government to tackle the health misinformation on the internet and social media. So that is something that patients, not just with vitiligo, but other conditions too, need to know, that there is a lot of misinformation on social media. Now, coming to what's new in the medical treatment. So in 2022, there was a landmark achievement when ruxolitinib was the first and only US FDA-approved topical treatment for the treatment of vitiligo. And, there is a lot of hype around it. The studies have shown that it does work really well in patients with facial vitiligo, particularly in combination with ultraviolet light exposure. But it's important to understand as a patient that ruxolitinib is not a cure for vitiligo. Every patient does respond differently. The repigmentation is generally slow, and it tends to occur over several months. So you would notice approximately 50% of patients achieving 75% repigmentation on their face in a year of treatment. So, there is a lot of information about this particular medication. There aren't, actually any comparative trials with the standard medications yet. So it's hard to say whether it's actually superior to other medications or not. But at the moment is not available through the PBS in Australia, but can be procured as a private script from some compounding pharmacies. There is some recent research on the role of systemic JAK inhibitors in the treatment of vitiligo, particularly extensive or rapidly progressive vitiligo. However, they are not currently in the approval stage yet. There are a number of different drugs that are under trial in vitiligo, and they're at different stages. Some of them have reached the phase 3 trials, including Rinvoq and Sotyktu. So Rinvoq is currently has completed phase 3 trials in vitiligo at a dose of 15 milligram once a day. So this is a medication that is PBS approved for atopic dermatitis in Australia, but has still not received FDA approval for non-segmental vitiligo. So that is a space that we are looking at. And, we might be able to consider it at some point once we have more data. Similarly for Sotyktu, it's in phase 2-3 trials, and we don't have the results yet, but this is something to watch out for. Now, alpha-melanotide is a melanocortin-1 receptor agonist. So it is, one of the first trials for the efficacy of this medication was published in 2015. That's about 10 years ago. And then there was a bit of a slump in publications regarding this molecule. But more lately, there has been a trial which has recruited about 200 patients across 3 continents and used as a subcutaneous implant once a month in combination with ultraviolet therapy. It can show good results. We're still awaiting the full results of the trial, but this is something that could have potential. Now, coming to what's new in light therapy, we do know that the excimer laser or the excimer lamp has been there for a while. And just to explain, how it, where is it placed in comparison with the ultraviolet B phototherapy. So the NB-UVB ultraviolet therapy, which is the whole body therapy or the hand and foot therapy, is 311 nanometers. And generally is a whole body treatment. So, the entire skin surface is exposed to the ultraviolet light. The patient needs to come into the clinic 2 or 3 times a week, which is similar for the excimer lamp as well. But the difference is that it is a more focused treatment. It is delivered with a handheld device. And, because it's more focused, needs to be used only for a few number of patches, and potentially can give better results because you can achieve higher doses. But it also is more costly. So the whole body therapy is covered to a large extent by Medicare, but the excimer is not. So, choosing between the excimer versus phototherapy, as I said, if it's extensive vitiligo, then whole body therapy is preferred. The excimer laser may be more suitable for more hard to reach areas or localized patches. And as I said, the cost is much greater for the excimer lamp. Now, coming to surgery for vitiligo, we know that we usually recommend surgery in cases of resistant patches which are not responding to medical treatment, patches which are showing white hair, which basically means that the reservoir of melanocytes is deficient or lost. So you need to introduce pigment cells from skin from other areas just to allow some repopulation of the melanocytes. And we usually recommend it in stable vitiligo, which means that the disease should be non-progressing for at least a year. And over the years, our enthusiasm to treat certain areas with surgical treatment has faded quite a bit. So areas on the tips of the fingers or toes or palms or soles, these are, difficult areas to treat even surgically. And we do understand that segmental vitiligo is definitely better responsive to surgical treatment compared to non-segmental. So these are the various treatments that can be performed surgically for vitiligo, and basically of 2 different types, tissue grafts and cellular grafts. So tissue grafts would mean picking up skin from one part of the body, normal skin, and transplanting it onto the vitiligo patch. And cellular grafts would mean taking the skin and then modifying it with enzymes to extract the pigment cells and to then just transfer the pigment cells onto the vitiligo patches. So I'm just showing some representative pictures of how these procedures are done. So this is suction blister epidermal grafting, where you create these blisters from the donor skin and use the roof of the blister to treat the vitiligo patches. There's split thickness skin grafting, which can be used for larger areas. And then there's non-cultured epidermal suspension or the melanocyte transfer, which is very useful when you're treating larger areas and also for good color match. So these are some of my patients. Now coming to the factors affecting the outcome of surgery, as I said, the disease must be stable before we go ahead and operate. Younger patients generally respond better. Segmental vitiligo or focal vitiligo generally responds better. And it's important to factor in the patient expectations and to be aligned well with the patient expectations when considering surgery. Now, lastly, we have done some research on the role of camouflage in vitiligo. And, there's definite evidence to suggest there are a number of different camouflage products available on the market. And we've found that, if we look at the impact of the vitiligo on the patient's quality of life, you can see the blue bars are the ones that are the patients who received camouflage in addition to their standard treatment, and the orange bars are the standard treatment alone. And we can see that, addition of camouflage to the treatment improves the quality of life definitely more significantly. Now, some good news for patients with vitiligo. Research has found that patients with vitiligo have a lower risk of Parkinson's disease, a reduced risk of melanoma and non-melanoma skin cancers, and possibly a reduction in other internal malignancies as well. And during COVID-19 pandemic, it was found that patients with vitiligo had a reduced rate of hospitalization and severe disease compared to those without vitiligo. There's also some evidence to suggest that there's a reduced risk of endocrine and metabolic disorders, blood disorders, and cardiovascular diseases in patients with vitiligo. And to end, these are some of the famous vitiligans, #vitiligans, as you see on social media. And, it's not just about the treatment of the white patches itself, but also healing, the effect on the psyche of the patient, and also the impact on the quality of life, and making patients accept who they are. So I'll end with a quote from Winnie Harlow: "If God wanted me to be black, I'd be black. If God wanted me to be white, I'd be white. But he chose for me to be both and original. So I guess that's the way I'm supposed to be." Thank you very much.
Thank you so much, Dr. Kanika. That was a really wonderful presentation. I had a few questions for our debunking of myths session, and you have answered quite a bit of it. But it's very interesting to see that you have mentioned about food as a factor. So, in Ayurvedic or any other medication that we have, traditional medication, I wouldn't say personally that they are wrong, but I think in our allopathic medication, which is modern medicine, the course of treatment is definitely slightly different. But I also feel that the effect of food is, I don't know, would you say it's a myth, or would you say it's, how would you say it? Like for me personally, so I started becoming a vegetarian, and I saw that my skin condition became better, but I cannot for sure say that that is the reason, so what would you advise? So there are some myths saying that milk and fish shouldn't be eaten together. So what would you say on that?
Yeah, so I mean, we as dermatologists trained in modern medicine would call these myths, because there is no scientific evidence to suggest that mixing milk and fish causes vitiligo. And we've seen back in India, patients from poor socioeconomic backgrounds, parents bringing in their children who are going to the extent of being malnourished because they're being, fed a diet which is very restricted. So, there isn't really any evidence, any strong scientific evidence to suggest that, certain, certain foods cause vitiligo or need to be avoided in vitiligo. So yeah, I mean, these are myths at the moment until they're proven otherwise. Yeah.
Yeah. So basically, there are no studies, scientific studies, which says otherwise. Yeah. So you also mentioned in your presentation that, I was about to ask you, are we more or less prone to, and you have answered that question.
Yeah. So there's definite research, and there's research from India as well on this. And there are genes found that are providing a protective benefit to patients with vitiligo, which is why, we treat so many patients with ultraviolet light, but it's really uncommon for us to encounter, I've treated more patients with phototype 4 or 5 skin. It's really, really rare to see patients, even having received years of phototherapy, for them to develop skin cancers. So there is a definite protective benefit. Yeah.
If someone were to ask you, is it contagious? How would you explain to them, doctor?
I would explain to them by holding the patient's hand. Yeah.
That's a good way. Thank you so much.
It's very well said.
Yeah, very well said. That's a good way to put it. So you had mentioned, because you have had previous experience in India, and you have mentioned that you have seen a lot of people with a bit duskier skin tone. The concern we have in Australia is so many of them are actually light skin toned, and it doesn't appear as much visibly as it would on us. And it is a concern. That was one of the points that I got through from a lot of members during our last Visible and Valued meeting. And it was interesting to see there's another point of view as well. Those who are light skin tone, it's not so visible for them, but they do have the condition. So that's the psyche, and the condition becomes a different thing. Would you say that it affects a lot of darker skin tones, or how would you put it? Like, just to make it clear to everyone that it's not only the visible who is affected.
Yeah. So as I said, the incidence or the prevalence of the condition is roughly similar across continents. So, it's not that it affects darker skins more than lighter skin patients. It's just that the contrast is so much more visible in darker skins that it becomes a greater concern or a more visible, problem for those patients compared to those with lighter skin. But yeah, I mean, lighter skin patients can still be equally affected by it, because, it's visible to the patient. And that's what's important, the assessment of your own self-worth at times, or the confidence, all of those things can be significantly affected no matter whether you are a darker skinned or a lighter skinned patient.
Yeah, absolutely. Doctor, would you say that the skin part, which is the white patch, would hurt, or it would be more sensitive when it's when we go under the sun?
So it's usually recommended that the white patches should be protected from sunlight. But as I said, the reason for that was traditionally that we don't want increased risk of skin cancers in those patches. But we've realized now that that is not necessarily true. Even absence of pigment in those patches is not really increasing the risk of skin cancer. There is a definite possibility that those areas could burn more easily, particularly if the patient is on light therapy. And that's when I would be more careful with, emphasizing sun protection. Yeah.
So, doctor, the last question for you is, someone with vitiligo, would they eventually turn all white, or it depends on person to person?
Yeah, so we've actually, it's, longitudinal studies on vitiligo they don't exist at the moment. So, there haven't been patients who've been followed up prospectively for years. We did do a cross-sectional study where we looked at, patients' history from what they recall in terms of when they first developed the disease and how, as per them, it progressed over the years. So what we found was that patients with segmental vitiligo is a different subset, because once they first develop the disease to the time that they stabilize or stop developing new patches, the period is roughly 1 to 2 years. And after that, they will not usually progress. Whereas for non-segmental disease, it's very, very unpredictable. You could have periods of stability lasting several years, followed by periods of activity. And not everybody who has vitiligo will eventually progress to fully white skin. So, you could stop anywhere on the spectrum, from less than 1% to more than 90% area affected. So each patient's journey is different, and, it's not really possible for us to predict it.
Yeah, absolutely. Thank you so much, Dr. Kanika. It was indeed an insightful presentation, and I would really love to work with you further. We would, speaking on behalf of the team, we would really love to work with you further. I understand that this is your first year joining the VA and also working here in Australia, if I'm not mistaken. We are looking forward to you seeing more of the patients who are based in Australia. And, I would love to hear from you next year what your journey is going to be, what your journey has been. Thank you so much, Dr. Kanika.
Thank you. Thank you so much.
So I'm just going to quickly update everyone on what's coming up from the VAA. So we have our visible and valued meetings every 3 to 4 months. It will be next held in mid of August. So I'm hoping for everyone to join us in, and we do have some discussions. Sometimes we do have dermatologists speaking in, or sometimes we discuss on social matters. It depends on what the topic is, but I'm hoping to see more of you here. The next thing I wanted to say is we also are launching our Vitiligo Kids Pack soon this year, hopefully this year. We are planning to get this Kids Pack to schools, to school counselors, to parents, because I think there are a lot of topics concerning children with vitiligo. Just to make sure that we can create some awareness and also give some information about the condition itself. The third one is just to inform you that one of the pharmaceuticals based in Sydney, they are planning to run a trial for kids treatment, and that will probably be end of the year, somewhere in September or October. They haven't reached out yet, but we have spoken about it to the representatives. Once we get any new information, we'll definitely let you guys know via email or on social media. If you're interested, we will see how to go about it next. And the fourth thing is we have VIPOC. VIPOC is Vitiligo International Patient Organization Committee, which will be having an international conference in Canada this year, somewhere in August. So if we have any additional study or information that we get from them, eventually we will be sharing it with you guys during our visible and valued meeting. So just look forward to it, okay? And the last point, and most importantly, as mentioned by Dr. Kanika, be very aware of scams on social media about treatments, and always speak to a dermatologist. We have great support from the dermatologists. I think we had here joining us Dr. Richard Whittle, Dr. Sachin Vaidya, and also Dr. Manisha Gupta, apart from Dr. Kanika. They have been very helpful, and so many others of, they are not here today, but they have been very helpful whenever we reach out to them. So please don't hesitate to join us. And next, a very interesting session, I will hand over to Anila.
So I have the pleasure of introducing our next speaker, who is a patient and community representative. We have Mayank Dawar. I really hope I'm pronouncing that correctly. I have a very complicated last name too, so I understand the struggle. He is a member of our VAA committee and community, he is a business operations and analytic professional with over 17 years of experience, originally from New Delhi, India, but he's currently based in Melbourne. Outside of work, he enjoys fitness, reading books on personal growth, playing chess, and spending quality time with his family. Mayank has lived with vitiligo for most of his life and is passionate about sharing his journey of self-acceptance and resilience, which I love. And Polo will be asking you a few questions.
Yeah.
Thank you for joining us.
So thank you so much, Mayank, for joining us. And can you just briefly tell us about yourself and when did your vitiligo become first a part of you?
Sure. So first of all, happy Vitiligo Day, everyone. It's great to be part of this association. All right. So just a quick introduction. As Onela already mentioned, my name is Mayank Dawar. You correctly pronounced. I'm yeah. I'm 40 years old, and originally I'm from New Delhi, India. So I've recently moved to Melbourne to join my wife and to start my career here. I have over 17 years of experience in data analysis and business operations. So let's talk about my journey. So first of all, this is my first time ever talking about my vitiligo experience on such a public platform. So obviously, I'm quite nervous, and the nervousness is all about what to say because when I think about discussing about my experiences, a lot of things come into my mind. So, yeah, I've lived with vitiligo from last more than 3 decades. So back when I was 7 years old, in year 1993, that was the first time my parents discovered a tiny white spot on my right knee. So obviously they were worried. So they took me to doctors, and after medical consultation, so we found that it's vitiligo. So that was the first time I remember it clearly that day. It is like always, it's gonna be very clear day. I can remember, I think, till the end of my life. So that was a big day for me.
I completely relate to that, Mayank. I know that, probably you didn't even understand what was happening at that point
Yeah.
of time. Yeah, and the reason why I kind of chose you, or I suggested you, I would say, to my team to get you as a speaker is because we do have wonderful members, joining us and who are willing to reach out and speak. But you were one of them who did not turn up for any of our events, but your wife used to come in support.
Yeah.
So I was really interested, and then your wife reached out and said that, hey, Mayank is ready to speak. So I was really interested to find out from you and also to let the other members know what made you think that this is the time for me to come up to such a platform and actually speak up about my condition.
Yeah, see, as I said, I'm quite shy person, okay, quite introvert, and especially when it comes to talk about vitiligo experience, so it's really difficult, as everyone can understand who have it. So yes, my wife has been attending this event from last 2 years, and on the first year when she attended, she was very positive. First of all, I was not aware when she attended it. So like after coming from the event, she was all excited and quite positive. And she told me everything that Mayank, you need to be part of this association, and everyone is so welcoming and so positive. I was like, okay, like speaking about like your own experience is gonna be very difficult. So yeah, I was not ready. I was
Mhm.
really ready. I'll be very honest with you. So now, like after 2 years, like she's been pushing me, and she has shown me that perspective that it's not about you, Mayank. Like
Mhm.
your journey, your struggle, if you share it, if it can like if it can inspire anyone, or if it can resonate like a little bit of something, so that would be like really big thing for anyone. And that would be like, that was a kind of a push for me to come out now and speak. So all thanks to her.
Yeah, thank you. Thank you, Shweta, for doing that. So Mayank, as someone who is very introverted, can you tell me one advice or tell the members one advice you would give to all those kids who have vitiligo, or all those who are still very, introverted as yourself, or, struggling to accept the fact that they have this condition? What would you say from just your perspective?
So I'll be very honest that it's not gonna be easy.
Yes.
because I was only 7 years old. I was really like unaware of what's happening. And I'll share one example when I really like felt that something really changed in my life. So I was in school. There was a uniform. We used to wear shorts. So when there was like a small white patch on my knee, so I was feeling shy and embarrassed. So I started wearing trouser. I was the only kid. So that thing separated me from other kids. I started feeling, no, I'm different. So obviously, I like it definitely took a toll on my confidence. I was like, I used to keep quiet, and even I got bullied because I was quiet, low confident. So it's not. I can understand, and I really don't have any particular answer. But yes, I can say that parents needs to be very supportive.
Mm.
Okay, because small children don't know what to do. They get affected when other kids or other people do something like look at in a bad way or make fun of it. Okay, so parents are the one, or like siblings or like other friends, they can be supportive that this is nothing. All right, no need to talk much about it, because this is really used to bother me. Like when some random stranger coming up to me and telling me, "Oh, you know what? I know one person who got treated, and you should do that." So I was like, I'm not asking for it, first of all, and do not like think me like, okay, I have really some issues. So that was used to like bother me. So one thing I really like suggest to people or children's that do not listen to everyone. Just keep on doing what you are doing. Whatever your parents have like decided treatment for you, just stick to it. This is very important. Stick to the treatment, whatever you're doing, because I know for some positive result, minimum it takes minimum to minimum 6 to 8 months. Some positive results, and you need to continue for few years to see the real results, which I didn't. I actually didn't. Because my parents were quite impatient. Anyone comes up and they used to switch me from one treatment to another. I did, I don't know, from allopathic to Ayurvedic, homeopathic to Unani, everything. I've even gone through this tissue skin grafted, which Dr. Kanika was explaining. I've gone through all the UVA, UVB, all the light therapy. But always it used to be like few months or maximum a year. I never stick to one thing. So stick
Yeah.
to one thing. Um, it might definitely give a better result.
Yeah. So my takeaway from your message is definitely consistency is the key. That's for
Yes.
sure. Yeah.
Yeah. Yeah.
So I really appreciate the fact that you came up finally, and I really want to say to all of our members, the only way we can run this organization if we have your support. And we
Yeah.
are really trying to work on how we can help kids in the near future. Um, Definitely adults are our priority as well, but I think from the mental health part of it, it's very obviously important for kids and adults, no doubts about it. But we can still express ourselves, but children, I think they can't really
The-
express themselves. Yeah.
yeah.
We're also trying to see how best we can work. Like you mentioned, you got bullied in school and stuff. We want to see how to create more awareness in school, how we can, the kids pack, how we can launch it and make sure that that helps a bit at least. And because our community in Australia, they're not as open as in US or UK, the community is bigger, and they are happy to come out there and speak, unlike us Australians. So I'm really hoping that our members will resonate to whatever that you have mentioned today, and come back and join us. Yeah. So
Yeah,
thank
definitely.
you so much, Mayank. It was a pleasure hearing from you.
Same here. I really love to be part of this association now. All
Yes,
the
I'm hoping to see you.
definitely.
Yeah.
Yeah.
Convinced you now.
Yeah, we're convinced, which is
Yeah.
good, which is good. Yes. So we are nearly at the end, but still a couple of things to do before we wrap up. Onila is going to just put up a link for you guys, for you to say something, give a few words, maybe type a few words for us so that we can save it and also share it with others.
So what I've got up on the screen, hopefully everyone can see the screen that I've shared. This is called Mentimeter. So basically you can use your phones to scan the QR code that is up on the screen, and it will take you to a website where you can pop in 3 words to answer the question. You can also put in the website, which is menti.com, and then pop in that code, which is 74424174. It's all up on the screen. And the question is, what words best describe how you want society to view visible differences like vitiligo? So while everybody pops in their answers, the words that are entered in multiple times by different people will appear bigger, and it'll basically create a bit of a pattern so we can see what words are more popular amongst our community. While that happens, I thought I would share a few things around confidence. I know a lot of people tell me that I come across very confident with my vitiligo, which I definitely am, but that's not necessarily the case for everyone. And there's definitely been times in my life where I haven't been as confident, and like Mayank, I can resonate with a lot of his story. I also developed vitiligo between the age of 2 and 5, and I wore stockings under my school dress. So similar to you, I was always the one that looked different in my school uniform, and I really had to work on building my confidence. Something that I found recently are these kids' books. This one is called I Absolutely Positively Love My Spots by Lydia C. Rivera. And recently I've come across a lot of children's books, specifically like vitiligo children's books, which I wish I had when I was younger. And this proudly sits on my shelves. So I get to, see the front cover and, be proud of the spots that I have. And I've been recently also talking to an author. Her name is Becca, and she is also based in the US. She's just written a book with her daughter who has vitiligo herself. Her daughter is about 7 or 8 years old. And this is the book. It is called What Makes You You. And it is available to purchase on Amazon now. So I just thought I'd share a few of these, confidence resources that, particularly for kids, that I wish I had when I was younger, and I'm sure you wish you did as well. And a couple of things for adults, because we haven't forgotten about you guys. Polo and I attended the dermatology conference a few weeks ago now, and I met Stephen Boris. He has a different condition, not vitiligo. His condition is called nevus. It is a birthmark that kind of changes like vitiligo as well. And he's written this book called Different, and it's coming face to face with your uniqueness. I'll just read a little bit of the blurb so you get an understanding. It says, born with a rare and large facial nevus, it's a birthmark, Stephen's early life was shaped by stares, questions, and medical trauma. Through these experiences and coping mechanisms of suppression, Stephen formed a certain behaviors, patterns, limiting beliefs that followed him into adulthood. And the book is about him coming face to face with his uniqueness and accepting his condition and learning to live with it. And I've been reading this myself, and I can definitely relate to a lot of it. So I thought it's something that you guys also might relate to. And I believe Polo has something else
I do like to read a lot. So I found, Onela, A No-Nonsense Guide to Vitiligo by Jan Vale, the CEO of Vitiligo Research Foundation. So if you can get a hold of that book, that would be great. I've put in an order, so just waiting for it to arrive. If you feel like you need some references, feel free to email us, and we will definitely send you the link. Otherwise,
or if you have good references that you've used and you want to share with the community, that's something that we would love to share around. We love to share the medical side as well, but also, like Dr. Kanika mentioned as well, it's the psychological side of having a condition like vitiligo and looking very different to everyone else. And we really want to be able to support you guys in any way that we can. And help us feel more accepted. Some of the words that are in the Mentimeter, we want to feel accepted, equal, understanding, unique, special, and normal. And there's some other words that very good that are very quite far away from me. There's respect, diversity, colorful. I like that one.
You'll probably post it up, yeah? It's a
Yeah,
beautiful one.
we'll definitely post it on our social media so you can have a look at the words that are included. And yeah, we wanted to end with something inspiring and positive for you to take away, because we really want to help take vitiligo from stigma to strength, and also help our community go from stigma to strength. And that's not just this year where it's the theme, but also in the coming years. So we'd love to know what you would like to see. I know we're, being held online, so it's a little bit harder to interact with each and every one of you, but we would definitely love to do that in the future.
Yeah, we normally do a face-to-face event, but this year the reason why we chose to do an online one is so that we can have more people joining us.
Across Australia as
across
well.
Australia. So I'm glad that we did it online. It was actually Ornella's suggestion, and Mohan and Nada also sort of jumped into it and said, hey, let's do it.
Because they're also from different states to us. So we
Mohan is
run
in
everything.
Sydney and Nada is in Cairns. So I'm so happy to have you all here today, and I hope that you had a good session. It is a special day for me personally. My journey has been with vitiligo for the past 3 decades, 30 years now. And all I wanted to do when I joined this association was to give the confidence and to uplift our members as much as possible, because I was very lucky to get that family support. As Mayank mentioned, parents are very important. I really stick to it. They are really important. And for adults like us, I think we need to support each other. So please join us, and we will put out a post survey email to everyone for you to give a suggestion on what the next topic should be, what is important to you, how you found this event, and what you would like to see further from us. And definitely we'll have our dermatologists, one of them, Dr. Kanika, as well, help from her to join us in few of our sessions to give us more inputs and further knowledge, and also to help us. If any one of you need any information at all regarding dermatologies, regarding treatment, please feel free to just email us, buzz us, look up for our social media. And thank you so much, everyone, for joining us tonight. I hope you had a good session. If any one of you want to say something, we'll give a minute or two. You can just speak up.
Please do. Yeah, feel free to unmute your mics and ask a question or say something. Yeah, thank you everyone for joining.
Yeah, anyone wants to ask something, you can ask Dr. Kanika as well. I'm sure she'll be happy to answer your questions, or even to us, we'll be happy to, answer your questions. Or even if you just want to say something, please feel free. You were great, Ornella. Thank you. And
Thank you.
Both of us, it's the first time for both of us to, work together and do this event.
Yeah.
We will get a copy out, of this whole session and also the presentation for the members.
Definitely.
Yeah.
I also really liked Dr. Kanika's her flow chart of someone with vitiligo. I think
there was a flow chart. I've
it.
never seen that before.
Yeah.
And I was mentioning to Ornella that that was interesting, the flow chart, the loop, the whole loop of,
And I think it really summed up and really looked at it holistically, not just on the medical side, but also acknowledged, all the different angles that your patient might be going through, which is something that, I find this, really important, and I've never seen it laid out like that before. So that was really interesting. Thank you.
Yeah.
We've got a little special guest coming to join us.
Yeah.
Anela, can you take the shared screen off for a second?
Yes, I can.
Yeah, I just had a question for Dr. Kanika. Can you explain the difference between segmental and non-segmental vitiligo, please?
Yeah, so segmental vitiligo and non-segmental vitiligo are considered very separate, just because they're different in terms of how they happen. They're both autoimmune, but with the segmental vitiligo, there is some role of either infections or something to do with the neurological segment, which localizes the disease to a particular area of the body. And the difference in the progression, as I said, is that the segmental vitiligo will very often stabilize early. And once it stabilizes, it usually does not progress beyond that. So, that's why, and the third thing is that segmental vitiligo will usually have more white hair. So less responsive to medical treatments at times, and better responsive to surgical treatments, just because, less inflammatory responses, faster stabilization results in better outcome from surgery if you're actually putting in cells or you're putting in pigment from outside. It's going to survive better. But just because more chances of getting white hair, so less responsive to medical treatments.
And in terms of how it looks, do they look different from each other? Or do they look the same?
So in terms of color, they'll both look white.
Okay.
But it's just about where the patches are located, whether they're symmetrical or asymmetrical, whether they're affecting one part of a segment of the body versus bilaterally symmetrical. Yeah.
Okay. Thank you.
Thanks.
So there's a question, where is the Vitiligo Association in Western Australia? So currently we do have representatives from each state, but we don't have particularly from Western Australia or any state, because it's a very small community and we are trying to grow it bigger. So if we get the numbers.
We do have it actually started in Western Australia.
Yeah.
So Dr. Prasad Kumarasinghe started
Yeah.
Vitiligo Association many years ago. And we do have some doctors and active participants in WA, but in terms of events, we haven't been able to do one recently. But we did have a World Vitiligo Day a couple of years ago in Perth.
But our association runs across all of Australia, so that obviously encompasses Western Australia as well.
Sure.
Yeah.
This was the special guest I was talking about earlier.
Yeah, we have Dr. Prasad. Yeah, he's one of the founding members of VAA. So he's been really helpful with us as well. And Dr. Kanika, I wanted to ask you, at what stage should someone come to a dermatologist or seek treatment?
Whenever it becomes a significant enough concern.
So
that's where you should seek the first treatment. So before you go to anyone else.
So some of them, they find a small white spot and they think that it's okay to just let it be, and suddenly the next thing they see is it becomes bigger without you noticing when it became that big, right? So from your message, I would assume that it's important to seek treatment when you see something concerning, obviously. Yeah,
absolutely.
Anyone else? Any other questions? Any other?
Could even be for us.
Nada?
If you have any questions.
Yeah, Nada?
Would just like to thank you all, especially Dr. Kanika and Mayank, for your wonderful presentations today. Dr. Kanika, that was a fascinating and very in-depth presentation, and we're really grateful. And to Mohan, Ornella, and Polo, thank you very much for organising this wonderful event today and making it so interesting and successful. And I'm very, very happy to be here myself, watching you all in your roles and what you're contributing to the VAA. As Ornella said, I was in it from probably about 8 years now with Dr. Prasad and Adrian, but it was time to hand over to our new team, and I'd like to congratulate them all on doing such a wonderful job and having the special guest with us today that they organised, and it was really excellent. So thank you. And Dr. Kanika, I hope we will come across you again, and we look forward to, as Ornella said and Polo said, seeing how your journey develops this year as well in your work and any new insights you'd like to bring us. So Thank you again, everyone.
Thank you so much, Nada. Just two more questions for Dr. Kanika. Are there, so Rachel has asked if there are any consequences if she doesn't, if we don't seek treatment. Like, how would you explain that?
As I said, for some people, a few patches, if they're not very visible or if they're on areas which are not bothering them or not, visible to others. And if it's not a concern, there's nothing wrong with not seeking treatment.
Mm-hmm.
But, if you're noticing it spreading and if it's becoming a concern for you, particularly if you're noticing patches around your fingers, toes, areas which are very hard to bring color back into, in those cases, we would generally recommend treating early and treating a bit stronger rather than going too slow. Just because, once it progresses to involve certain areas, it's very hard to bring the color back in those patches. So, yeah, I mean, the treatment or the urgency of the treatment will also depend on which areas it's localizing on.
Yeah. That's a good point, Dr. Kanika. So there's another question from Grace. She's a math student, and she's asking, in your experience, doctor, how do you see the treatment landscape shifting over the next decade? Do you think there should be a change in clinical outcomes with regards to that, in your experience?
So, as a dermatologist, we treat a lot of autoimmune conditions. Vitiligo is one of them, and the other common one is psoriasis. So, there are overlaps in terms of treatment as well as, immune pathways between psoriasis and vitiligo. And we do know that, with psoriasis, the biologics have actually changed lives for many patients with psoriasis. And with the use of the JAK inhibitors and possibly with more research and more specific targeted treatments, I think we're probably looking at safer treatments, safer and more targeted treatments, which could be, used safely, lifelong or for long periods, which could keep the disease well controlled without having much side effects. But, at the moment, we aren't there yet. And the other thing with vitiligo is that you might be able to control the immune responses, the autoimmune process. But the next challenge, which doesn't exist for the same extent in psoriasis, is to bring the color back from areas where it's been lost. So that becomes another challenge. And, it's probably going to be a combination of treatments in vitiligo to kind of give the best outcomes.
Thank you, Dr. Kanika. Anyone else want to speak up or say anything before we wrap up?
I was also going to mention something that I've noticed recently is the patterns in nature. If you look at a eucalyptus trunk, for example, there's lots of different patterns and organic shapes, and often I find that very similar in the way that my vitiligo appears. And if anyone just saw my cat that was hanging around us for a second, she's got a little white face like I do, and she's got sticks down her back. She's gone now. in different brown streaks. Often I see or like compare that with animals in nature, and I find it so fascinating, all the prints that they have, and us in humans don't tend to appreciate that necessarily as much. So I find that a very interesting comparison between that. Yeah, look, she's back.
Yeah, she does have a white face. So thank you so much, everyone. It's been a pleasure. And thank you so much for joining us. And we are really looking forward to more sessions. Thank you again, Dr. Kanika. Thank you, Mayank. And thank you to all of you members. Thank you, Nada. Thank you, Mohan, for helping us. Sorry, doctor. Before we wrap up, there's another question. Is there any treatment for people with extensive vitiligo to depigmentation, small pigment patches?
This will probably be
so I had a slide on this, but I just let it out at the last minute. I thought, I just wanted to keep it a bit short. So yes, there are treatments available to depigment normal skin if the vitiligo has become quite extensive and only small pigmented areas are remaining, we have treatments to depigment the skin. And these could be either in the form of creams like Benoquin, or, even with laser treatments. It's possible to remove the pigment. But, you do need to maintain ongoing sun protection so that pigment doesn't return back, because that does happen as well.
Yeah, absolutely. All right, thank you so much. That's the last question for the day, and maybe we'll talk about it in our next Visible and Valued. So do join us.
And if you have any questions, feel free to reach out to us via socials or email. If you have any questions like these, let us know, and we can then pass them on to dermatologists to answer and get some information back to you. Thank you.
Thank you, everyone. Have a good night.
Thank you.
Bye.
Thank you.
Bye.
Bye-bye.